Hi viewers, I am Arun Gopal Krishna. Welcome to the Facebook live session. Today we have, tomorrow is the World Cancer Day and the theme for World Cancer Day is Close the Care Gap. Okay, I'll come back to you on that in a minute. Before that, I just want to invite a senior medical oncologist, senior consultant medical oncologist, Dr. S. Suresh, with over 14 years of experience. Is having experience in medical as well as radiation oncology. And cancer has a long inspired fear. There is no doubt about it. Cancer is scary, but sometimes the fear of cancer is enough to cause someone significant distress. There have been many advances in the field of cancer in recent years. And overall, people with cancer today are living longer than ever. Despite that, it is understandable that cancer still invokes fear in people. Dr. S. Suresh, Senior Consultant Medical Oncologist, VS Hospitals, sees and shares some suggestions for putting these fears to bed. Welcome to the Facebook live session, Dr. Suresh. It's a pleasure to have you with us.
Thank you, Arun, and thank you, VS Hospital, for giving me this opportunity. And as you said, tomorrow is World Cancer Day. February 4th of every year is celebrated as World Cancer Day. Each year they might have a different theme, and for this year they have the Close the Care Gap theme, and this will be running for next 3 years and with different priorities. So this year, as we said, clear the
care gap.
Care gap. So close the care gap. Here we will be patients might be having a different cancers. They might be from different walks of life, and with different cancers, they might be at different stages and coming from different backgrounds, from a village to a city to a cosmopolitan center, and then they might have access to treatment, they may not have access to treatment, they will be fit enough or may not be fit enough, and they might have a money to treat or may not have a money to get treatment. So these are all the gaps which we see in our cancer patients. So as a cancer care giving community, we are in a position to close this care gap. So the first year, 2022, is the first year of promoting this event. And then coming to close the care gap, we have been trying from VS Hospital for all methods. We have some patient support program and other things. And as a crown to this, most of the problem is with the fear of cancer. So we are starting the close the care gap with clear the fear.
That's fantastic, Dr. Suresh. Dr. Suresh, my first question, what are the causes of cancer?
So cancer causes are n number, multiple factors play into it. The most common thing, as many people think, is a genetic thing. Yes, genetics plays a role, but we can see that only 1 in 20 patients will have a genetic cause. Other causes being and environmental factors, either from smoking, a sedentary lifestyle, or by infections like viruses, bacteria, or maybe due to their occupation. See, mine workers can have a patient working under asbestos sheets can have mesothelioma like that. A patient working in a mining industries can have, person working in soot or garbage clearing factories, they can have all bladder cancers and all so forth. So occupation, environmental health, genetic, sedentary lifestyle, good food habits. So these are the most common thing, and added to that, we have the most common smoking and alcohol as one of the common factors. But it is always a multifactorial. You cannot say this is the cause for cancer. It can be one of the causes for cancer, but we have to try and keep all the causes at bay and be with a good teetotaler and have a good physical activity and try to take good organic foods and easily boiled homemade foods so that we can all close the triggering factors for cancers.
Dr. Suresh, My next question is cancer contagious? Does it spread?
No. So the problem for most of the caregivers, so that is what the basic question is. So the thing is, the immediate, the husband or wife, or the sons or daughters, or even the parents, or the siblings, they are ready to take care of the dear and near ones. And the only question to them is, it is not them getting disease, but the other persons in the home getting a disease. So to make it very clear, it is not a contagious disease like any other COVID or a communicable disease. So it's a non-communicable disease. And if you have a patient at home, sharing their plates, sharing their tumblers, sharing the restrooms with them is not going to make you have a cancer. It is not at all contagious. Be along with them, give support to them, close the care gap which you may not have if you are afraid of going near to them. Always be strong, and you don't have a risk of getting the cancer from them.
For clarifying that, Dr. Suresh, actually, that was a very good message. Which stage of cancer is not curable?
Yeah. So as you said, the basic idea behind, as I have been stressing all along throughout my other meetings also, the idea behind staging is to know how to treat a cancer. What is the apt method of treating a cancer? So to give in a nutshell, cancer is, most of the cancers are staged into 4 stages, stage 1, 2, 3, 4. The idea behind this, stage 1 is within that particular organ, and a surgery or radiation can cure the disease. Stage 2 is a size bigger than that, and in case of surgery, it has to be a bigger surgery. So that is stage 2. Stage 3 is, it is in the organ and it has spread to the nearby lymph nodes or getting attached to a small nearby sites. So this is stage 3, and this is stage 3 means there one modality of treatment. So most of the treatment modalities in cancer is either surgery, radiation, or chemotherapy. Here, in a stage 1, one modality is more than sufficient. Stage 2, you might need 2 modalities. Stage 3, again, you might need 2 or all the 3 modalities. And if the disease is from one organ, it has spread to another distant organ, which might be due to either spread through the blood or by lymphatics, then it is stage 4. So this is stage 4, means then surgery or radiation, which is a local treatment, may not be suffice in this stage 4 patients. So stage 4 patients are one which needs chemotherapy the most, and these are the patients who are by technical not curable. And this is why we say it's not curable, means because it has spread and we need to give a continuous treatment. Whereas in the other 3 stages, you have a limited number of surgeries, limited number of chemotherapy or radiation sessions. In stage 4, you have to continue with chemotherapy. Even if the patient has got a good response to the treatment doesn't stop there. We need to give again medicines to keep the disease under control. So this is where we say the disease is not controlled, not curable, but controlled.
Thank you, Dr. Suresh. So viewers, you should not be afraid. Early detection is the key. Dr. Suresh, what type of cancers can be fully cured?
Yeah, we have many cancers. Most of the childhood cancers, if treated early, can be cured. And even in adults, you have cancers like Hodgkin's lymphomas or testicular tumors or early cancers. Most of the stage 1, stage 2 cancers where surgery and radiation chemo is also possible. So these are the diseases where it is curable. So nowadays we have advances in our treatment so that the percentage of curative response is increasing.
Dr. Suresh. Dr. Suresh, is chemotherapy really effective? Does it really help cure or prolong life? Can you enlighten us on that?
Definitely. So the chemotherapy is the major thing. So as I had answered a few minutes back, stage 4, the main modality of treatment is chemotherapy. Most of the people who come to us are in the fear that chemotherapy induces side effects like hair loss, vomiting, and they become very weak and all those things. Remember, if not for that chemotherapy and with the associated side effects, which is easily manageable, the life of the patient is going to be very, very little. The benefits of the treatment is more than the side effects which patient perceive or the patient attenders which they Google through or WhatsApp through or their friends input says. The side effects are very, very negligible compared to the benefits what they give. So even though we know as an oncologist, as a medical oncologist who deals primarily with chemotherapy, we know what are the side effects of the chemotherapy and how to manage them effectively also. So the idea is to give them a good quality of life. So don't get afraid of the side effects. The side effects are easily manageable, can be overcome, and the effects of treatment are far better.
For educating us, Dr. Suresh. Dr. Suresh, how effective is radiation? Does it kill the normal cell also, or can it be targeted cell?
Yeah. So radiation is a form of an X-ray treatment. So after surgery, which has been there for more than 2000 years since Shushruta started his surgical acumen, surgery has been for long the only mode of treatment for cancer, and all other native medicines were there. But by 1896, when X-rays were found out, discovered, then invented, then X-ray treatment came into radiation. So that was where radiation started, and that was the second modality of treatment in cancer. And we have seen that even stage 4 disease, even a patient who has developed metastasis to bone or brain, effectively, if treated with radiations, they go on to live longer. As I said in the chemotherapy, even though there is a side effects, the benefits overweigh the side effects. So radiation is not like a current. So what we say current is not that you are going to get a shock or something. It's a radiation is an X-ray treatment. It is as similar to an X-ray scanning or an CT scanning, but at the higher dosage, effectively the cancer cells are killed. The surrounding minimal cells are also normal cells are also killed, but they are at a minimal rate only. So even if you are giving a complications from radiation, it is a temporary one. Within 3 or 4 weeks, they regain and come to a normal cell. So don't worry about radiation effects.
That was comprehensive, doctor. Dr. Suresh, do we have oral medication for cancer?
Definitely. So problem is that whenever we say of chemotherapy, patient always tend to think that it is an IV chemotherapy, and that's by injections and admissions. But with the latest medicines, innovations coming up in cancer care, we have oral chemotherapy medicines also coming up now. And we have oral chemotherapies which are targeting particular genetic variants. So these are all called tyrosine kinase inhibitors. And also we have now CDK4/6 inhibitors which can boost your immunity in cancer cells. So oral medicines are coming up in a larger way. And a problem with patients are that if we say IV chemo, they want an oral chemo. If we say oral chemo, then they are not satisfied that we are giving a chemotherapy treatment. They always think in the IV. So it's always a paradox. The other side of the river is always green. So that's how they think. But we have an effective medicines, and imatinib was the first medicines which has been genetically targeted agents, and it has made a sea change in the management of chronic myeloid leukemia and other cancers like the GIST. So it has got a very good cancer clearing property. So oral medicines is also possible now.
Thank you so much, Dr. Suresh. Suresh, this is for unmarried people. If diagnosed with cancer, after treatment, can they have children?
Yeah, this we have to divide into two parts. One is pediatric cancers, one is adult cancers. So pediatric cancers we see, and we have treated a number of pediatric patients in the past 18 years, and we have seen that they have grown to an adult, and then they have got married, and then they have born child also. So pediatric cancers, they do very well. As I said earlier, pediatric cancers are very curable cancers. They do very well. They can have children. Coming to adult, we also have the problem of because the ovum or sperms start coming up when they are in their teenage people, and the chemotherapy or radiations which we might give might affect their potency and virulence. Say they might not be able to give birth to and children. But we have some other cancers where the life of the cancer patients may not be more than 2 or 3 years. Some cancer patients in the early stage, they will be having a normal life. So we will be identifying these patients who will be having a normal life, early stage, and we will be advocating them how to have a fertile life after getting over the treatment. So we have sperm banking or oocyte preservations, and also some patients in the early cancers, after their regular treatment, we advise them 2 or 3 years of gap post treatment, and once they recover, we always advise them to go for childbearing. So 50-50 chances are there for a normal childbearing now.
Okay. Dr. Suresh, how do we prevent cancer? Which age group gets most affected?
See, a human body is like a machine. So the machine can break down at any point of time. So any machine, as it gets old, will get more cancers. So age is one of the most important criteria to get a cancer. Our immunity gets down by age. So more the age, our immunity is down and it is not able to repair itself. So the inability of our body to repair the defective cells is called cancer. So as age increases, we have more cancer proportions. And we might ask then, why should a child have? The children's disease will be more a genetic related event, whereas adult will be always an environmental influenced or a somatic mutations, that's what called. So most of the patients we see in the age group of above 50, 55. And so that's what we have been observing in our practice.
Very helpful, Doctor. Dr. Suresh, how frequent cancer health check or screening can be done?
We have something called master health checkups, which will be doing the basic routine testing for our liver, kidney, diabetic and hypertensive management. And to some extent, doing an X-ray and ultrasound might help. But when it comes to cancer screening, we don't have screening for all the sites of cancer. So the idea behind screening is you have to catch the cancer before it develops. So that's called the screening. Others are early prevention or early detection and treatment. Screening is before you get the treatment, how do you screen? So screening is approved right now in breast cancer, cervical cancer, and to a certain extent with colonic cancers and lung cancers. So except for these 4 cancers, we don't have screening procedures. And the second part was how to prevent, right? So how to prevent is, as of now, we said a healthy lifestyle, don't get exposed to triggering factors. And we have a vaccine right now for female children's aged 9 to get before their age of marriage. We have a vaccine for prevention of human papilloma virus induced cervical cancers. So this is one vaccines right now available for prevention. Or other like for screening, we have mammogram for breast, pap smear for cervix, low dose CT screening for lung cancer, and maybe we can do a serial PSA for prostate cancers. And other than that, we need to regularly check our breast, testes, and all those things, and our skin to see whether there is any abnormal changes in our body. So that is also part of a screening program. And if you detect something abnormal, go to your family physicians and get it cleared. And what was the other part? Can you repeat the question again? Prevention?
No. You have answered that. Doctor.
That's it.
Usually, Dr. Suresh, what happens when a person goes to the hospital? They go and inquire for example, master health checkup. Is there anything specific they need to ask that they need to undergo cancer checkup? Can you please educate us? Because if we go and ask, we want to go for a complete master health checkup, okay, and they will not be cancer specific or something like that.
Definitely. So master health checkup, as I said, it will be mostly basic lifestyle and disease identifications only. But when you need to go for a master health checkup, we have recommendations for screening. So any females aged above 40 years should undergo an mammogram and pap smear yearly. And any family history of cancers, moreover, if it's going to be an ovary, breast, cervical, or a large intestine, or CT scan, or prostate. So these are the patients when they should inform the consultant doctors, and then they can go a simple battery of tests which can be done with a blood test like serum cancer markers, CT, low dose CT, and pap smear mammogram, which is already included in our master health checkup patterns. And the other things which we need to tell the family physician is when your relative, when your near and dear had the so and so cancer. So the period when you need to check yourself is 10 years before your index case. So suppose in your family, you have a family member who has been detected with a cancer at the age of 45. And I said you have to do a mammogram by age of 40. But in this scenario, when your family member had got a cancer breast at the age of 45, then you should start screening yourself by 35 years. So that is when your complete history. So the idea began the doctors asking you a family history of cancer or no. Thing is, if you have a cancer, then we go on to ask what was the age when your family member had that incidence. So we'll be guiding you when to start screening for it.
That was very elaborative, Dr. Suresh. Dr. Suresh, what kind of food and lifestyle habits affects cancer?
So this is one big question, and there are so many false propagandas also going on. So how to go about this? Have a healthy lifestyle, do exercise, and even simple walking can do. Adding to that yoga or any kind of aerobics or any kind of play which you are interested in, yes, you can proceed with that. Then avoid junk foods, avoid grilled foods. It's better that we stick to our natural way of eating. So we may not do better with the Western culture or East Asian culture, because that kind of food is apt for their soil and for their climatic perspectives. Our ancestors have been having the food which is very apt for this condition. So continue with those kind of food. Other thing is avoid smoking, avoid alcohol, which is not at all an effective thing. The chances of smoking and alcohol causing a cancer multiplies by 400 times compared to a normal person. A puff of smoke from cigarette which you takes at least 20 years to go from your lungs. So even one puff of smoke increases your cancer risk more.
Thank you so much, doctor. Doctor, how to detect cancer in children, and what are the most common cancers in children?
See, in children, you might have common cancers like retinoblastoma, Wilms tumor, acute lymphatic leukemia, and something like hepatocellular carcinoma in a childhood, and testicular germ cell tumors also can be there in childhood patients. The thing is, you have to have a careful screening, and whatever the parents say, particularly mothers say, we have to be very, very careful in their history and examine for them. So suppose for retinoblastoma, that is the affecting the pupil of the eye, the patient may not have a fixing of vision for the children. And when we put a torch into them, and then they will be reflecting like a cat's eye. So vision problem and cat's eye reflex, these are all similar to having a retinoblastoma, and we should be very careful. And if a family member, if the sibling has got a retinoblastoma, then the chances of the next children getting retinoblastoma is also very high. Similarly, if there is any bulge in the abdomen, we have to be very careful and see whether there is an hepatoblastoma that's involving the liver, or Wilms tumor involving the kidney cancer. And any fever, failure to thrive, and bleeding tendencies, then it can be a feature of acute lymphatic leukemia. Then we have to go to the physicians and evaluate for that. And any abnormal swelling in the bones or muscles, so that also can be a rhabdomyosarcoma or an bone tumors. So these are the things. And children being very small in size, or they'll be able to visualize very easily for them. Only thing is they may not be able to tell their problems very clearly, unlike an adult. But I had a child by 8 years, and when she came and said, "Sir, I have giddiness," so I was taken back. How can an 8-year-old say about giddiness? And I asked, what is the definition of giddiness? And she said exactly what is expected. And when we screened her for a brain, she had a brain tumor. And this was 15 years back. The IQ of the children have increased very, very, very high now with all the cell phones available. I think anyone who is seeing the cell phone and able to read now can come up with varied complications, and we shouldn't ignore their complaints. We should examine for their complaints.
Thank you, doctor. That was very elaborate. Dr. Suresh, is this cancer treatment meant to be a lifelong treatment or shorter duration? Can they go back to their routine life?
Yes. As I said, first initial 3 stages, it's a limited treatment for the particular site, for the particular stage. This and this is going to be the treatment, and post that treatment, they can go back to life, normal life, and they can go back to normal work. And we have seen n number of patients who have been normal. We have patients who have been coming here from Dubai or Sri Lanka, having a treatment here, going back to their native place, and then continuing their work and coming after 2 or 3 weeks for the next cycle. So initially, yes, first 3 stages, they can have their normal life. Even in stage 4, 20% of the people will get cured, though they'll be on the treatment for so long, and they'll be able to carry on their lifestyle. The other 80% will be very terminally ill, who may not respond to treatment even during the chemotherapy. They might progress. So this is the only small fraction of patients who may not be able to carry out their normal life.
Thank you, Dr. Suresh. Can you brief us on surgical role in cancer treatment?
Yes. So the biggest myth, what the patients call is, you put a knife, the disease spreads. So I think a surgical oncologist will be the apt person to answer, but he'll be also annoyed. As a medical oncologist feels that when you say a patient has got complication, I'm not going to treat, but the benefit is more. Similarly, when a patient comes and says that, "Sir, you put a knife, it is going to increase." Moreover, even if you are going to do a biopsy, because without a biopsy, we may not know what the disease is, whether we are dealing with cancer, if at all cancer, what type of cancer, and if at all type of cancer, is there any latest advanced technique, genetic mutations, which can be giving more appropriate treatment to that. So right from biopsy, stage 1, stage 2, stage 3, clearing the tumor, surgery plays a major role in that.
Clarifying that, Dr. Suresh. How about hereditary cancers?
Yeah, hereditary, as I told, 5% of all malignancies can be hereditary. And most of the hereditary cancers like retinoblastoma, ALL, all will be in the pediatric age group. When it comes to adult, it might be breast, ovary, a large intestine, prostate, pancreas. So these are the hereditary cancers. But even in this hereditary cancer, we can see that only 1 in 20, that's 5% of the patients will be having a hereditary cancer. All other 19 out of 20 or 95% of the cancers which we see are coming out of the blue. It's coming randomly.
Thank you, doctor. Doctor, doctor, how about survival rate of cancer in this digital era?
Yes, survival rate has increased very, very, very good because of the advances in surgical technique and their post-operative care, advances in the radiation and trying to minimize the radiation side effects, and advances in chemotherapy, both in treatment with targeted therapy, immunotherapy, and also in decreasing the complications due to chemotherapy. We have seen a very good improvement in cancer survival, and also because the patients also themselves come up with an early stage compared to what has been there 20 years back. So in 2022, the cancer rate is far better than what it was in 2000.
Great, doctor. Doctor, take home message. What's your take home message?
Cancer, everyone. Cancer means fear for everyone, but it need not be fear or end of the road for every patient. And don't get afraid and be at home or do Google search and get to an wrong ideas. Consult your doctor, have faith in one of your family members and family doctor, and go by their suggestions. And when you shop more, you might get confused, but at the end of the day, you may not get a clear picture, and your confusion grows more. Start treatment as early as possible. Have faith in one doctor.
Dr. Suresh, thank you for that. Whom to consult first, Google or doctor?
So always doctor, and maybe you can Google the doctor.
Okay.
Which doctor?
That's a smart answer.
Yeah.
Thank you so much, Dr. Suresh, for a valuable time today. And clearing the fear. After talking to you, we come to know that cancer is curable if detected early. As viewers, there is much more optimism today about the future of cancer treatment than there was 10 years ago. We have a much better understanding of the disease at the molecular level. There are better drugs now and better ones coming down the line. Cancer is curable if detected early. It's important that we start treating cancer like any other disease and get over the stigma. Thank you so much. Take care.
Thank you.
Thank you, Dr. Suresh. Thank you, Dr. Suresh. And we are just waiting for your interview tomorrow on Radio City FB page.
Yeah, that will be on the Tamil language. I think whoever is finding it difficult in English might switch on to the Radio City one.
That's fantastic, doctor. Thank you so much for valuable time today. Thank you so much.
Thank you.
Thank you, viewers. Thank you.